In this video, different surgical incisions will be explored, which are used to perform the most common surgeries involving the abdominal organs. The first one is this incision, which is just beneath the subcostal margin and is known as the subcostal incision or the Kocher's incision. This surgical incision is ideal to explore the gallbladder, particularly to remove the gallbladder in the procedure of cholecystectomy. The second abdominal incision that we will discuss is the Mercedes-Benz incision, which gets its name because of its typical appearance of the Mercedes-Benz sign. This incision is carried out while performing the liver transplantation surgeries. The third incision is this midline incision, which is performed in the center of the abdomen along the vertical direction. This incision is particularly useful when performing the emergency laparotomies in order to gain the intra-abdominal access to the abdominal organs and to have a better view of all the structures intra-abdominally, particularly in the road traffic accidents and in the blunt trauma surgeries of the abdomen. Just adjacent to this midline incision, another incision which runs parallel to this is the paramedian incision. This incision is used to gain the intra-abdominal access, particularly for those organs which are found more laterally, like the spleen, kidneys, and adrenal glands. Now we will explore two incisions which are commonly used in the surgeries to remove the appendix in the procedure of appendectomy. The first one is the McBurney's incision or the gridiron incision, which is performed in the right lower quadrant of the abdomen. This incision is performed at the site of McBurney's point, and the McBurney's point is identified by joining the line from the umbilicus to the anterior superior iliac spine. So this point is present 2/3 on the line which runs from the umbilicus to the anterior superior iliac spine. Closer to this, another incision which is performed for appendectomy is the Lanz incision. This incision is performed along the lines of the skin and therefore it is cosmetically better. Now a very important incision which is performed just above the pubic bone, pubic symphysis, is the suprapubic incision, a convex shaped incision which is performed in the center of abdomen in the lower quadrant. The other name for which is Pfannenstiel Incision or the Bikini's incision, because it is performed along the bikini line. This incision is famous among the gynecologists to perform the C-sections, and it is also used for the procedures like prostatectomy, which is the removal of the prostate gland, and cystectomy. Moving on to the 8th abdominal incision, we have the Rutherford Morrison Incision. This incision is performed in the left lower quadrant of the abdomen if the surgeons want to explore the sigmoid colon, and particularly this incision is also very famous in the surgeons who want to perform the renal transplant surgeries. Lastly, we have the transverse abdominal incisions, which get the name because of their transverse or the horizontal dissection of the abdomen. This incision is not used for the exploratory procedures like laparotomies, but it is performed when the stomas need to be made in the patients after doing the colostomy or the ileostomy. So the different and the common abdominal incisions that we have discussed today are the subcostal or the Kocher incision, Mercedes-Benz incision, midline incision, paramedian incision, McBurney's incision, Lanz incision, Pfannenstiel or the suprapubic incision, Rutherford Morrison incision, and the transverse incisions.